points are better together, like baguette and cheese, peanut butter and jam, or the front mu and the back shu acupuncture points. This is what I want to talk about today, not the baguette and cheese, although I can talk about that for a long time too, but how we can utilize to our best ability the front mu and the back shu acupuncture points. In this video, I'm going to cover the simple difference between the front mu and the back shu points, how to use them for chronic versus acute conditions, my favorite point combos that work like magic in clinic, and I'll share mini cases to show you how I use those in clinical practice, and maybe they'll resonate with you and you'll use them as well. Stick to me till the end because I'm going to show you a combo hack that will make your point prescription way more powerful. And trust me, once you get it, you'll never forget it. Welcome back to my channel. If it's your first time here, I'm Clara from Acupro Academy, and I create Chinese medicine and acupuncture content for students and practitioners, making it easy to grasp and fun to learn. Let's go. Before we start diving into the back shu and front mu acupuncture points, I wanted to truly thank you for all your support, your likes, your share, your comments. Every time you engage with my content, you help the algorithm found more people that would be interested and can benefit from the hours I spend creating it. I wanted to share one of them with you because every one of them really touched me. Here's one that I received this morning just before I was about to record. Glasses off. Clara, I've said it before, without your work, I'm not sure I would have carried on with my TCM studies. It has helped me so much. Thank you. That makes my day. Because the content I create, the courses, the master classes, the books I have, this is all to support practitioners and students. All the DMs, emails, and comments I receive from you, I cherish them because this is why I continue to be passionate about sharing my knowledge and my years of experience with you. So I hope that you benefit from it and in turn, your patient. Okay, so let's start with those back shu front mu points right now. We have 12 main meridians pertaining to 12 organs according to Chinese medicine, while the back shu and the front mu point connect and pertain to each of those organs. So we have 12 back shu point located in the back and 12 front mu point located in the front. The back shu points are in the bladder meridian, 1.5 tsun lateral to the spine. Each Zang organ has one associated back shu point. Shu means transport. They transport qi directly to that pertaining organ. And they have strong effect on the organ itself. The front mu point obviously are located in the front on the chest and abdomen area, often near the organ they represent, except for the sanjiao because this is an organ that encompasses all the other organs. But most of them, it's going to be near that physical organ. Mu means to gather or to collect. So they collect qi from the organ. When it comes to yin and yang, always remember that we always compare two entities that have something in common. For example, night and day, summer and winter, right? So it's going to be the same with the front mu and the back shu. So I don't want to confuse you because I'm going to say things that are probably different and opposite. So you're going to go, what? You just said this and now you're saying this, which is the opposite. I don't understand. So remember, it depends what you're comparing it to. Yes? Okay. So the back shu point overall are going to be treating a lot more chronic conditions pertaining to the Zang organ more, specifically for deficiency. Does that mean that you cannot use the back shu point of liver, let's say bladder 18, for excess pattern in the liver? No, that's not what it means. It is the comparison of the back shu to the front mu that makes the back shu more useful for deficiency in general and specifically for the Zang organ. Now, when it comes to the front mu point, we use them a lot more for the fu organ or the yang organ and acute condition. Does that mean that we can't use liver 13, the front mu point of the spleen, when there is spleen qi deficiency? Absolutely not. I am just comparing again the Back Shu versus the Front Mu. Now, both entities, the Back Shu and the Front Mu, are also used in diagnosis for palpation in order to figure out if some of them are tender. So if you're palpating in the back specifically, I see this in practice for years. Often people will say, oh, I have a knot between my shoulder blade. And if I palpate, often it is bladder 15, the back shu point of the heart, or bladder 14, the back shu point of the pericardium, or around those 2 points. And often those people have anxiety or insomnia. It so correlates with the diagnosis. So using the Back Shu and the Front Mu to palpate, to see what is tender, to figure out what organ is affected, is a very powerful tool in TCM diagnosis. Another one that I think is often very tender on patient is gallbladder 25, which is the front mu point of the kidney. And when there are issues with the physical kidney, I'm talking about people with kidney stones or have issues with their kidney in the past or urination, I found often that point is tender. So remember that specifically the front mu point, they're located close to their physical organ. So they are going to be very useful for physical organ issue, not necessarily TCM pattern due to TCM diagnosis. Does that make sense? Let me give you an example. If someone comes in with asthma, that's a lung disorder in the Western sense. So lung 1 will be a very useful point because it is the front mu point of the lung, which pertains to the lung organ, right? I can use lung 1 and bladder 13 together, bladder 13 being the back shu point of the lung, to try to tonify lung qi affecting the organ of the lung. Now, let's look at another pattern, kidney yang deficiency, which technically in TCM has nothing to do with the physical kidneys, right? Often it's low libido, maybe diarrhea, early morning diarrhea, edema of the ankles, feeling cold. That has not much to do with the kidneys. Maybe the edema of the ankle, but in general, it's very much more TCM perspective when it comes to symptoms. So what do we do with this? We often are going to use more the back shu point, like bladder 23 of the kidney, in order to tonify the TCM kidney. Would we use gallbladder 25? Probably not. But we would use gallbladder 25 if there was kidney stones pain while the person has to pass the stones. Does that make sense? So you could see gallbladder 25 much more related to the organ and the acute pain. That's what we said when we first started. Yes? Okay, so a little bit more complicated, right? You can make it very simple and say, okay, well, this person has liver qi stagnation. I can use bladder 18 and I could use liver 14. Yes, you can. But if it's an organ problem, physical liver organ problem, I would use liver 14 more. If it was more of a liver qi stagnation TCM pattern, which has nothing to do with your physical liver, I would use mostly bladder 18. If you've been around for a while, you know that I've created 3 books by popular demand in order to support practitioners and students in their TCM journey. But maybe you don't know that I offer a lot of specific continuing education courses to help you improve your skills. And within those courses, you can choose short 90 minutes masterclasses on subjects like TCM diagnosis, allergies, headaches, migraine, how to grow a practice, or you can use more comprehensive courses on the balance method, musculoskeletal pain, fertility, pregnancy, mental disorders, thyroid, vitamins and supplements. They're all there for you, no matter if it's a masterclass or a comprehensive course. You'll get lifetime access, continuing education hours, certificate, and a 7-day money-back guarantee, so it's risk-free. I really, truly want you to benefit from it. The link to the store is below. Check it out. Now, another thing that's said in practice is the front mu point located below the navel are going to be used more for deficiency, to tonify deficiency. The back shu point above bladder 17 are often going to be used for excess. Is this a rule that is 100% black and white? No, Again, TCM is nuances, right? So it doesn't mean that if someone has long qi deficiency, we can't use bladder 13. It just means that if someone has long qi deficiency, but they also have a lot of phlegm, that they're coughing or nasal congestion, bladder 13 is going to be a great point because it has excess and deficiency together. Yes? You're going to have to take this with a grain of salt and see what resonates with you. A lot of books will say Back-Shu are more for deficiency and chronic disorders. Front-Mu on the opposite side would be more for acute excess disorders. The second one is anything above bladder 17 is going to be used more for excess, while below the navel, it's going to be used more for deficiency. Again, this is just different kind of school of thoughts. Another question I get often is, in my treatment book, I give guideline of what points to do for certain disorders and patterns. Let's say we talk about osteoarthritis, the pattern, the symptoms, the formula, and the guiding points protocol. And people will say to me, well, in this protocol, there's points that are in the back, like Back-Shu points, and there are a point in the front, like stomach 36 or Front-Mu point. How do I go about this? I'll share what I do. It might not resonate with you, but let me tell you. If a patient comes with back pain, I have two options. Option one, treat the back pain, ask them if they're comfortable face down, and then I will treat the area affected. Yes? Okay. With distal point, local point, etc. Now, if this patient is a pregnant woman in her third trimester, I know she can't lay on her stomach. She could lay on her side, absolutely, but most of the time the comfortable position is sitting propped up. So for me, I am not going to do any back point. I'm going to do more of a front treatment. I usually can use, let's say, the balance method, whatever works for you. But we're going to have to adapt. Some of my patients do not like to face down at all. Some of my patients love facing down. They do not like face up. Follow your intuition. That is very key to a great treatment. And listen to the patient. Ask question. What resonates with them as well? It's a partnership. It's not just us doing treatment. Does that make sense? So when it comes to the Front-Mu and the Back-Shu point, do I do them both? Let's say I have a patient that come with asthma. Do I do bladder 13? Do I do long one? Do I do both? Now that's another thing. A lot of practitioners like to do 20 minutes on a back treatment, take the needles out, flip the patient, and do 20 minutes front treatment. That is very common. And if that's what you like to do, awesome. I don't. I prefer laying there and get in my parasympathetic state, and it takes me a while to come down depending on the stress I've had. So for me, laying there and not being turned and start over, I like that better. So because of this, in 90% of my treatments, I will do either a front treatment or a back treatment because I like my patients to at least stay 30 minutes with the needles. That might not work for you, but this is what works for me. So I wanted to share. Now, let's say you want to do front and back. So for example, you can combine bladder 18, the Back-Shu point of liver, with liver 14, its Front-Mu point. This is really good to harmonize the liver for stress, for stagnation, for emotional issue, and digestion issue, as well as liver issues. Now, another combination that is interesting is pairing the Back-Shu point with the Front-Mu yin-yang opposite connecting organ. What? Let me give you an example. Spleen and stomach, connected yin-yang organ, yes? Okay. Back-Shu point of the spleen, bladder 20. Front-Mu point of the stomach, Ren 12. Combining those two are great when there's middle jiao issue affecting both the stomach and the spleen. So this is really something I love to do. Another one that is really good in practice is combining liver and gallbladder. So you could do gallbladder 24, which is the Front-Mu point of the gallbladder, combined with bladder 18, which is the Back-Shu point of liver. When there is disharmony between the two, or there's joint issues, stress, shoulder tension, a lot of issue with both gallbladder and liver, this is a great combo. And I've done it a few times when I really want to address both. So I hope I didn't confuse you too much with all this information. Here's what I do often in practice. 1 week, I will do Back Shu points. So let's say my patient says liver qi stagnation and heart and spleen blood deficiency. So I can do bladder 15 for the heart, bladder 20 for the spleen, and bladder 18 for the liver. And then I can do distal points to complement the whole treatment. And then maybe the week after, I might do liver 13, liver 14, which are front mu point of the spleen and liver, and then Ren 14, the heart front mu point. And obviously more distal points to complement my treatment and to follow my pattern of diagnosis. And then often I'll ask the patient the week after, did you feel better and enjoyed the back treatment or the front treatment? And every single time they will pick. It's very rare that someone says, it's the same. They will say, oh my God, I love facing down and I felt so good after. Or I loved facing up and I felt so great after. And then you can build on this. Yes? Good. Have you signed up to my free weekly newsletter yet? This is where I share exclusive content, tips and tricks on TCM and acupuncture I don't share anywhere else. I talk about case studies. I really give a lot of value and it's completely free. Sign up. The link is below for you. In order to practice, I think it's great to look at little mini cases. Let's start with case number 1. A man comes in with sudden diarrhea after eating some food. His stomach 25, which is a large intestine mu point, is very tender. So you combine stomach 25 with bladder 25, the back shu point of the large intestine. That would work really well to clear the diarrhea. Then you would add up spleen 9 because it's the best point when there is excess dampness, and if there's diarrhea, there's excess dampness. Because this is really acute, you want to ask if the diarrhea is very smelly, then there's heat. We probably would do large intestine 11, large intestine 4 to add to this. Stomach 36 because of course it's the digestive commander point. And of course, you could do the digestive diamond, which with stomach 25, you can add up Ren 9 and Ren 6. And if you just wanted to do a front treatment, then you forget bladder 25. Second mini case. A woman comes in with chronic bloating, specifically worse after meal, and poor appetite. So you're going to really harmonize the whole digestive system. And this is when you can do the back shu point of spleen, bladder 20, and the front mu point of the stomach, which is Ren 12. That will help the digestive system together. That's what we were talking about before. Then stomach 36 to harmonize the whole digestion, right? That makes sense. Bloating after meals, we're probably going to have to use spleen 3 because it's the yuan source point of the spleen and really helps in that transforming, transporting function. And then we're going to do obviously spleen 9 because that's going to help with the bloating, the water retention. Yes, this is how we select our points. Now at the beginning, I said I was going to give you a hack that works really well and is effective in practice. And once you know it, you won't forget it. Are you ready? Let's look at the hack. Remember, always do your TCM diagnosis and follow that diagnosis. But sometimes it's not always easy. Here's the hack. For liver qi stagnation and liver blood deficiency. Now, this is very common in practice. I see this with a lot of women. Women with amenorrhea, scanty menstruation, women that are very blood deficient, pale and poor. Pale face, pale lips, pale tongue, pale nails. And then poor is poor sleep, cannot fall asleep, usually due to anxiety or worry, overthinking. Poor energy, so fatigue, right? That is a typical blood deficiency. But at the same time, this person's really stressed and they have a lot of liver qi stagnation, a lot of PMS, breast tenderness, moody prior to menstruation, shoulder tension, headaches that is worse at period time. And you can see that those two are there. Here's my hack. If we decide to do a back treatment, we are going to do bladder 17 to tonify the blood, bladder 18 for liver, bladder 20 for spleen. We will do spleen 6, because we could still do this when the patient face down, spleen 4, liver 8. Beautiful combo. 6 points, fantastic hack. If we're doing a front treatment, we are going to do liver 14, liver 13, liver and spleen front mu point, stomach 36 to tonify blood, liver 8, spleen 6, spleen 4. Beautiful. Now, you could also add up liver 3 to relax that liver qi stagnation. I hope those hacks benefit you and in turn your patient in practice. As I said in the beginning, baguette and cheese go really well together. Back Shu and Front-Mu are fantastic, specifically if you palpate them for tenderness to figure out what's going on with the patient when it comes to TCM diagnosis. I hope this benefits you and in turn your patients. Watch this video next, and no matter what, keep rocking it using TCM because after all, acupuncture rocks!